It will make it illegal for them to cancel your policy when you get sick if you do get a disease or some illness or have an accident in which you have a lot of medical expenses. That's called rescission, and it was a common practice. It's been one of the tools that the industry has used for quite a long time to be sure that they're not paying more for medical care than Wall Street wants them to pay. And it will require them to spend at least 80% of what we send them in premiums on medical care. So there are a lot of things they don't like about this legislation. There are some good consumer protections. Some things have been made illegal that should have been made illegal a long time ago. But what they want now is to, despite the rhetoric, they want to preserve the individual mandate. That is most important to them. But they would like their newly elected members of Congress to begin to strip out some of the consumer protections that are in this legislation. So the whole notion that Congress is going to repeal this bill is nothing more than, well, it's a smokescreen. It's not going to happen, folks. The insurance companies don't want it to happen. And you can rest assured that the lobbyists for the insurance companies have already had meetings with the new members of Congress and said, here's the way things are. You might believe, actually, the talking points that we and others have given you, that this is a government takeover of the healthcare system, but just forget that. This is actually a legislation that will keep us in business. The insurance companies cannot go on without this legislation. They needed this because you cannot continue to shift more and more of the cost of healthcare to individuals and expect people to continue to buy their products. More and more people will find that they just have to forego buying coverage. And you can't keep shifting the cost of care to folks and forever, because eventually people will realize that there's not value there and will stop buying their products. So they need this to force people to buy their products. And they've explained that by now to the new members of Congress. They will go through the motions of passing a bill in the House, no doubt about it. The Senate will not. The Senate won't even bring the bill up for a vote because there's no member of any committee that will allow that to happen. So the House will get, the Republicans will get what they want out of this. They'll be able to tell the folks who voted for them, who truly think this was the government takeover, that they tried. And it was the bad Senate that kept them from doing this, from doing what they should do. When all along, what their real objective is, and what they're working on right now, is to attack the consumer protections and the new regulations in the bill and try to strip them out one by one. And they will be using language like I write about in this bill to try to make us think that that's good for us. They will try to say that what we need now is a common sense, market-based approach to healthcare reform. Remember those words because you'll be hearing them more and more. Doesn't that sound right? Doesn't it sound good to you? Yeah. Well, it will to most Americans. They will say, boy, that sounds like maybe that's exactly what we should finally do. Have a common sense healthcare reform plan that's market-based. And they'll say that the insurance companies, they'll say that this bill is a one-size-fits-all. So what really we need is to give the health insurance companies more flexibility. They need to have more flexibility in being able to design benefit plans. Benefit design flexibility is what they'll be asking for, so that they'll be able to get Congress to repeal the section or undo the section that prohibits them from selling products to senior citizens before they reach Medicare age and charge them more than 3 times as much as young people. They'll say, that's too restrictive, and by doing that, we're punishing young people. So they'll be trying to divide the young folks against the old folks by saying that these are too restrictive. So these are just examples of some of the things they'll be doing. You can bet your bottom dollar that the rhetoric you will hear will be directed at repealing the good things that are in the bill, using fancy language that'll make you think it makes common sense. So with that, I'll just end, and maybe we can take some questions for the rest of the time together. Thank you very much.
So What I would like to do at this point, number one, is remind people, if you haven't filled out a pledge card, please do so. Secondly, to say that in February, put on your calendar, February 22nd, we're going to be talking about Vermont and what's happening in Vermont, both from a point of view of how the state is moving in the direction of single payer and what we can do from New York to help that happen.
That's at Beth Israel?
Pardon?
That's at Beth Israel?
That most likely will be at Beth Israel, but if you have signed that card tonight, you will know exactly where it will be. And I would like to just ask Lori Wen to make one last comment this evening.
Thank you, Thank you so much for coming tonight. And thank you to PNHP-NY Metro for the honor to serve as your new executive director. Thank you, Mr. Potter, very much for this event. I would just like to reiterate what Mr. Potter was urging all of us to do. Yes, we sound like a broken record when we say, call your congressperson, call your senator. Often people say, well, okay, I did. I didn't get what I wanted the last time I did it. Well, keep doing it, and I urge you to do it tomorrow or Wednesday at the latest. Some of you may know that originally, before the horrible tragedy in Arizona, originally the Republicans had scheduled a vote for this Wednesday, the day after tomorrow, to start to repeal PPACA or Obamacare, or the new health law. That vote has now been delayed because of what happened in Arizona, but it's going to happen soon. I urge you, as a single-payer supporter, to call your congressperson and say, to repeal or not to repeal, that is not the question. We need to go beyond that, because either the current system or the new law is not going to work, because both of those, we're putting our trust in the private health insurance industry. And we know that we cannot do that. So call your congressperson, tell them to go beyond what we really need, beyond talking about repeal, is a single-payer Medicare for all system. Thank you.
And thank you again to Mr. Potter. We really have enjoyed having you here.